Hi, hi everyone. My name is Dr. Mazhar, and today I would like to start about urology. In urology, I would like to talk about some pathologies and their some pathology related to renal system and their management and their surgical management. So this is our main focus today. So today we talk about the urology. In urology, we start about about the kidney. So we first of all, before starting, I just would like to start about the urinary symptoms. So as you can see in that slide, a lot of urinary symptoms like this is the one like hematuria. So I will talk in further in next PPTs about further symptom. So our first symptom will be hematuria. As you can see that hematuria. Hematuria means that the blood in urine. So what's the causes of this hematuria? First of all, kidney lesions. What's the problem inside the kidney? So this is being called acute glomerulonephritis, then tuberculosis, then stone, then trauma, then renal tumor, renal infarction, or polycystic kidney disease. So this is the causes of hematuria. And then you can see in the picture that there is a cyst, ureter. This will be polycystic kidney disease. So it's a congenital condition in which there is a formation of cyst. As you can see in that below picture, there is a lot of cyst. So this is a healthy kidney and this is a cystic kidney. So this is a polycystic kidney disease. This is the congenital genetical defects of the gene. So you can see in the picture that this is a kidney and cystic kidney that surgeon removed that kidney from the body. They did nephrectomy. Then there's a renal tract lesions which can lead to the hematuria like neoplasm, stone, according to the bladder, cystitis, neoplasm, stone, trauma, and for prostate problem which can lead to hematuria, prostatitis, neoplasm, and urethra problem like urethritis, trauma. And others like bleeding disorders like hemophilia, anticoagulant drug like Exap, Loprane, and malignant hypertension. When there is a blockage, stenosis in the renal artery, so this one we call malignant hypertension. And then there is a bacterial endocarditis. So bacterial endocarditis mean it's not related to kidney. It means that bacteria which infect endocardium, that bacteria also infect kidney. So this can also lead to hematuria. Then pain. What's the causes of pain in the renal system or urology case? First of all, there is a renal pain and ureteric pain like ureteric colic pain like stone or any inflammation going on inside the bladder, inside the ureter. This is a ureteric mean ureter. Then there is a vesical pain, like the pain in the bladder. Many causes like you can say CA bladder and urinary retention. So this is a many so this is a causes main. Then there is a prostatic pain like BPH, bipolar prostate hyperplasia, and then there is a urethral pain like in the female case UTI, but male UTI less common. Or there is any structure formation inside urethra, so it can lead to pain. Then there is a frequency. So after that, we do some investigations to rule out what's the cause. In because we are talking about urology, so I just discussed symptoms. Now I'm just talking about what function we will do in for checking renal function. We do blood urea, we do serum creatinine, creatinine clearance. Then we do plain X-ray, intravenous urography for checking the stone, any mass. Then retrograde IVU through urethra. This is mean through urethra, and this is the through the vein. Then we do renal arteriography to check the renal stenosis, to check the renal artery condition. Then other investigation we do in urology, cystoscopy. Cysto mean to check the bladder for any CA, carcinoma, or any pathology is going on. Then we do CT or MRI. This we call intravenous urography. We do in urology. As you can see, dye is injected and X-ray is taken. So this is a dye in vein. So when this dye become injected in the vein, so they travel through whole of the body, then enter in the kidney, and you can see there's a kidney, renal pelvis, and ureter. So this dye give us a picture, give a picture of normal kidney. If there is a stone stuck here, so this dye will not pass down. So this IBU give us some picture that it's actually where the stone is lodged. You can see appreciate this picture that this is a IBU picture we will do in urology. So this is a dye and this is also a dye. So this we see in the renal pelvis and kidney. So actually kidney present in the retroperitoneum. Then we do cystoscopy. This is cystoscopy for checking the any mass, anything like this. You can see stone. Stone is present in the bladder. So we check through the cystoscope. Also, we can do through cystoscope, we can remove stone from the bladder. So this is a bladder. Bladder we also call vesicle. Then what's the causes of hydronephrosis? What's the meaning of hydronephrosis? Hydro mean water, nephrosis mean that any blockage in the ureter. So water will not move forward. So it go back in the kidney and make the kidney full of water. So this is a hydronephrosis. It's an emergency condition. We have to do immediate action. When you do go into the urology ward, you can find minor cases or sometimes you can see that this is a hydronephrosis, also a complication of stone. Because when stone in the ureter, you will not do any intervention. So finally, what stone can lead to the hydronephrosis. So hydronephrosis is a aseptic condition and as a result of partial or complete obstruction to the outflow of urine. When there is obstruction, so urine is also contain some water. So water will flow back to the kidney. Then there is a unilateral hydronephrosis and bilateral. Unilateral mean one ureter block and bilateral mean both like in some problem in the bladder. So this is a thing. Then you can see obstruction in the ureter and the forward flow not happen. In here forward flow will happen, but there is no. So the urine go back and they make kidney enlarge. Hydronephrosis. You can see in the picture ureteropelvic junction, ureter. So when there is any blockage in the ureteropelvic junction, any congenital or stone lead, so they can lead to hydronephrosis. They may can lead to kidney failure. This is an emergency condition in urology. What's the causes of unilateral hydronephrosis? There is an intramural causes, extramural and intramural. Intramural means some inside the lumen, like in the wall of ureter. Stenosis, any stenosis in the ureter or any structure formation in the ureter or bladder cancer. It can lead to what? Unilateral hydronephrosis. Then extramural causes mean that if there is CA colon, CA colon is because intestine, anterior intestine behind what? Ureter. So when there is a CA colon, so can be it be metastase and put pressure on ureter, so it becomes stenosis, it lead to what? Hydronephrosis. Then rectum and then rectum pathology, CA rectum can produce and prostatitis, BPH can lead to this. And intraluminal means stone. So you can see the pelvic interjunction, vesico-ureteric junction, vesico-ureteric reflex, pelvic ureteric junction. It can lead to enlarge of the kidney. Then there is a bilateral hydronephrosis, congenital. A congenital stricture of the external urethra. Congenital stricture of external urethra, like meatus or phimosis. This is a congenital structure of the external urethra. Then congenital wall of the posterior male urethra or congenital contracture of bladder. So they can also lead to what? Hydronephrosis, bilateral hydronephrosis, congenital condition. So this is the acquired. Acquired causes. This we talked about the congenital, and this is the acquired causes. Like I already talked about in start of the lecture that benign prostate enlargement or carcinoma of prostate can lead to bilateral hydronephrosis and inflammatory or traumatic urethral stricture or stone. So this also lead to bilateral hydronephrosis. So in the radiology, and then we do the kidney radiological evaluation. We do kidney ureter bladder film. This will be called KUB X-ray. We will check the stone. Where is actually the stone? So this is a location of kidney at it present TX12 to L2 to 3. So these are things of right kidney somehow lower than the left kidney due to some pressure of liver. So that's the thing. And then you can see in the X-ray KUB. This is a minor calyx, major calyx, renal pelvis, pelvic uterine junction, right ureter, and bladder. C. Right ureteric and B. So urinary bladder. So maybe stone here. So dye will not pass down, but this is a somehow dye will pass. So this is the thing, and then this is the anterior. Then there are this are both are the this is the anterior view, and this is the posterior view in which you can appreciate the picture.